Hello everyone and namaskar. I am Dr. Nirbhay Shah. I am an orthopedic surgeon practicing in Rajkot, Gujarat. Rajkot is one of the fastest developing cities of this country now. I am practicing here since 1992. I passed my MS in 1990 and then for 1 year I was at Sancheti Hospital under Dr. Rajiv Arora learning arthroscopy because that was my first love even then. So I came back to Rajkot in 92 and started doing arthroscopic surgery as a part of my practice. I used to do trauma and spine and elizero because we used to do everything then. And arthroscopy was a part of my practice. But then as I started getting more interested, I started doing more work and patients started coming to me. Slowly and steadily, other surgeries started going into the background and arthroscopic work and joint surgery work went on increasing. I used to do knee arthroscopy only in those steps. Then in 97, I did my first shoulder arthroscopy. And then I added a few surgeries in shoulder arthroscopy because I did not have much training then. Over and above that, I used to do ACL reconstructions. PCL reconstruction, I did my first in 96. And I did ACL avulsions arthroscopically. But PCL avulsions I used to do open. But last around 8-10 years, I am doing PCL avulsions also arthroscopically. Then in 1998, I started doing meniscal repair. I read an article by Dr. Craig Morgan and understanding that it was a very good method and very easy and simple to do. I started doing outside in mulberry knot technique using PDS2 sutures. And even till now, till today, I do the same technique outside in mulberry knot using PDS2 number 1 sutures. I find it very easy, very cheap, very much affording to all my patients. Sometimes if I get an idea that I need to do a repair during the surgery, I don't even charge my patients because the expense is less than 500 rupees in their entire surgery. So my entire process of understanding arthroscopy was that it's a very costly surgery as far as instruments are concerned and as far as implants are also concerned these days. My efforts all these years has been to decrease the implant cost for the patient so that even a poor patient can afford arthroscopic surgeries, meniscal repairs, and even exotic arthroscopic surgeries without spending much from their pocket. And I can reduce the charges without loading my earning or decreasing my earning from that patient. Then in 1999, I was lucky enough to get the ANA, the Arthroscopy Association of North America Fellowship. I was there for 6 months. We were only 2 doctors from the entire world who got that fellowship that year. And I was with Dr. Freddie Fu in Pittsburgh and Dr. Christopher Harner. Both were excellent knee surgeons. Dr. Freddie Fu passed recently because of cancer. Dr. Christopher Harner, I believe, is retired. But I thank them both for giving me a beautiful vision of how to do many things in the knee. Then I went to Dr. Yamaguchi in St. Louis, Washu, for shoulder surgery. And learned a lot from him, understanding rotator cuff repairs. They were a very new thing. Arthroscopic rotator cuff repairs in 1999-2000, unbelievable. Then I went to Dr. Gary Peeling. He was a pioneer for wrist and elbow arthroscopy. So I learned that prone position elbow arthroscopy from him and wrist arthroscopy from him. He was kind enough to help Smith Nephew donate a wrist arthroscopy set for me. And I used the same set till date because I couldn't afford a 2 lakh rupee set in 99-2000. It was very costly even then. That amount was huge at that time. But they were kind enough to help me and so started doing wrist arthroscopy since 2001. And we still do dorsal ganglion excisions and TFCC repairs very regularly arthroscopically. I added shoulder arthroscopy, wrist arthroscopy, elbow and ankle in 2001 once I got trained. And I was then also with Dr. Stephen Snyder for shoulder arthroscopy then. After coming back, I was more and more into arthroscopy and joint surgeries and ligament surgeries and open and multi-ligament surgeries after that. And more work started coming to me. I became better and better as my experience increased and understanding increased. And internet came and Google came and that, awareness has slowly increased and we can now see surgeries and understand surgeries very easily. But it was not so easy then. Then I started realizing that I have to refer my osteoarthritic patients out of Rajkot, and I do everything in the knee, and I can do anything in the knee, including all ligament reconstruction. I can open the knee and close it with doing everything. I can reconstruct everything if I want. Then why can't I do a replacement? I don't think replacement was that difficult, but there was a huge aura around replacement, and it was considered, it's a very difficult surgery, an elite surgery. So luckily again, I got a fellowship with Dr. Ranawat, the best joint surgeon and a replacement surgeon till date. And I was with him for 3 months. Then I went to Australia for 6 months. And again in Australia, I was exposed to partial knee replacement. So what is known as unicompartment knee replacement. I learned Oxford partial knee replacement there and came back and started doing both totally replacements and partially replacements since 2005 and 2006. So I have now an 18-year experience in partially replacements, 18-year experience in totally replacements. We have more than 1,500 partially replacements in our list, and a few thousand totally replacements again. And in totally replacements, I do exclusive subvascular approach since 2011. I do all my surgeries, primary knee, revision knees, thin patient, old patient, young patient, obese patient, it doesn't matter. All patients I enter through subvascular approach. I'm very happy with the approach. There are huge advantages of it, and we are going to discuss that in all our subsequent videos that we are going to put small understandings and basic understanding of different techniques, different aspects of joint surgery and other things. Recently, we have started a exclusive center in Saurashtra for idiopathic flexible flat foot, or what is now known as adult progressive collapsing flat foot. We started doing sinus tarsi implant, the hypercure implant, and we have found excellent results. We now have 14 cases in the last 1 year, and we are all our results are very, very satisfying. Patients are very happy, and we can talk of that also in subsequent videos. We'll talk of that also. And we have started doing artificial ligaments recently. We did a PCL evolution, which was 1.5 years old, and we did an artificial ligament added to what was already done with the help of a pull-out suture. So we could talk of artificial ligaments also in our subsequent videos. Now, my basic understanding, because as I came back to India, I also started getting fellows in the recent last 10 years or so. And my basic idea, or the fundamental idea of doing this series of videos is what Dr. Ranawat told me. I went to him after my completion of my fellowship and I asked him, sir, what can I give you? We can't give you anything. You have so much beyond what we can give you. He said, you don't need to give me anything. You just have to pass it on. Give it to your students, give it to next young orthopedic surgeons who come to you. Educate them, teach them what to do and particularly what not to do. And that will be better than any gift that you can give me. So I have understood that. I've started taking fellows, teaching them, and I want these videos to reach a wider audience, and it's purely educational. No, we don't want to earn anything from this. We are not related to any implant company. Our aim is not monetary or financial gain, and we will not promote any implant or anything. This will just teach you basics, anatomy, approaches, what to do, how not to do, what not to do, examination of the knee, examination of the shoulder, how to do a partially, how to do it totally, how to do a subvascular approach, how to do a basic primary totally, what are the fundamental points that have to be done so that you don't dislocate or you don't do limb length discrepancies, how to give a plaster. Sir John Charlie, who possibly should have been given a Nobel Prize in his lifetime, but as surgeons don't get Nobel Prize, I think that was the biggest reason of him not getting, who could devise a total hip replacement, but his books are there on how to give a plaster, how to do close reductions. So my desire in this series is also how to give a plaster, how not to give a plaster, what are the things to be taken care while giving a plaster, how do you reduce simple fractures, what you should not do in fractures, when not to over-operate. We start doing more surgeries which are sometimes not needed. Conservative treatment of fractures and other diseases. What can be done in conservative treatments, dietary profiles and understanding of diseases. Obesity is such a big problem. We can even, that causes a lot of osteoarthritic and other problems and spine problems in our profession. So that also we can discuss in future. We are going to welcome your suggestions and ideas that do you want new topics or some topics that you want and have not discussed. Then I can prepare. If it is in my knowledge, if I have an understanding of it, only then I'll come out with it. Otherwise, I'm sorry, but if I don't know the topic, I can't tell it to you. Then you have suggestions. You don't like this, or you want this to be better, or this thing to be told in a more deep way. Then I can do that in subsequent videos. We will welcome your suggestions, your ideas. Please let us know what you want, what you don't want, any changes in the format, any changes in anything extra that you need in the videos. Please do let us know. We'll do our best to make all young orthopedic surgeons happy, more practical, and more well-versed with basic orthopedics and basic joint surgery. Thank you.